Hi everyone, it is Dr. Leiva, Queen of Biohacking, and I'm here with Kashif, the DNA company. So nice to have you.
Good to be here.
I'm excited because I heard a lot about your company, a lot of good things, and I wanted to go into what is the DNA company and especially some specific questions because I've experienced a DNA test and I had some things go wrong. And I wanted to see how your company is and how it might be different. So nice to have you.
Yeah, pleasure to be here. And I mean, it's what the DNA company was and what it's becoming. Where because of what we were learning from DNA, we've learned there's so much more we need to understand that's preventative in nature. You know, a simple example, right now, our CEO is working on a early detection breast cancer test where from a teardrop in your eye, we can see the proteins that elevate typically when you have breast cancer. It's a very early detection prior to tumor formation even. And so now the intervention, so much more impactful, right? Versus trying to fight stage 4.
Yeah,
right down the track.
That's amazing.
Yeah, but going back, way back when, you know, I went through a journey of being sick, not coming from the industry, not formally trained, and having to heal myself because I was failed by my doctors. I didn't know until that time that this is what doctors do, is like respond. And I mean the allopathic, primary care.
Yeah.
And so I started to learn, and I learned that my own genome was fairly messed up. And so the same exact habits, foods, environment as my business partner, who I spent all day with, made me sick, didn't make him sick. And that was the first time I realized there's a such thing as bio-individual. We're not all the same.
Precision medicine. Yeah.
And also prevention.
Yeah.
The disease is not something that just happens, it's caused. And I caused it to myself and I now don't have it anymore, right?
Yeah.
So and the company grew out of that, is now turned into many other tests.
That's awesome.
Yeah.
Yeah, I did a 23andMe test, and they actually sent me an email that my information was stolen. Do you have any issues like that with your company?
So big challenge in general. So anybody watching, if you're looking for a DNA test, assume your data is being sold. And I say this, straight out because DNA is the only service in the sort of lab work world where you only do it once because your DNA doesn't change.
Yeah.
So the business sucks. Right? It's not like blood work or stool, whatever. You keep redoing it, rechecking. So the investors all said, well, how are you going to make money? And so the companies all became data selling companies, right? Let's create a widget that gives you some entertainment, and I'm going to collect your data, and I'm going to sell it to Glaxo for 10x what you paid for that original test, which is literally what they're doing, right? So we had to make a decision, which is, do we do that, right?
Yeah.
Or do we actually become the company that mines that data, provides people the insights that they actually intended to get from this testing in the first place, and then support them clinically. And working with amazing doctors like you or even our internal team, getting the system using genomics functionally.
That's awesome.
And that's what we did. So what we test for, pharma doesn't even want to buy. So even if we decide one day to become a data selling company, so we had to make that conscious decision. And I would say, ask any, whether it's gut, DNA, epigenetics, whatever, ask them what happens to the data. And then if they're selling it, then the product isn't even testing for the right stuff to begin with.
Well, the other day my son went to the hospital, and as I signed the intake form, I actually took a moment because it was taking so long. It said and there was no way to not consent. It says your labs, everything will be sold. Everything you have to consent for whatever research they're doing. And I was really shocked because, when you're going through the emergency room even, so it's not just DNA tests, it's pregnancy tests, it's a lot of different tests. So I know a lot of people are skeptical, but I'm like, you downloaded 50 apps that took way more than even that would take from you. So it's kind of funny how people will look in one direction than the other. So healing your own condition through that, can you tell me more?
Yeah. So I had horrible eczema. My left eye was literally sealed shut, and it went down my face into my neck. I had psoriasis all over my hands, knuckles. Migraines was the worst part. That's what actually drove me to, I was such a warrior in my business that I fought through the eczema, I fought through the pain, I fought through depression, I fought through gut issues, but I couldn't fight through the migraines. They shut me off, debilitated. That's what drove me to clinicians. And so after going through naturopathy, traditional Chinese medicine, and starting to feel better, I still didn't know why.
Yeah.
Right. And that's really what I want to know. And that's what I was asking my doctors, which drove me to naturopathy and traditional and all that stuff, which was, you've given me a pill, you've told me what this thing is called, why did it happen? And why all these 5 things all at the same time? That can't be a coincidence. And I the first time realized that that's not what they do. I didn't know. Right? I thought that you can find out your nutrition plan and etc. Right? Anyways, I discovered through my genome, as an example, there's a gene called GSTM1 that is a primary first-line defense for your gut. So glutathione, this antioxidant your body uses to bind, remove toxins, pee them out, sweat them out, it drives that activity in your gut. And certain genes, variations, mutations, whatever you want to call them, I don't even have the gene. It's missing. There's something called a copy number variation, where the actual total number of copies can vary from 0 to many more than you needed. I don't do this job. So when I said earlier, me and my business partner had the same habits, same everything, we spent most of the day together.
Yeah.
The food that we were eating made me sick and didn't make him sick.
Yeah.
What Health Canada, where I live in Canada, deemed as safe based on the average population, they didn't have me in that study. Right?
Yeah.
So this is where I realized, N of 1, who am I? Bio-individual. And that's the one thing, and there was more. We could spend an hour just talking about how broken I was, right?
Yeah.
But so I started to deal with that properly, fixing my gut, didn't even know it was leaking, eating what I was actually supposed to eat, and just giant rabbit hole. So that led me to get my arthritic mother out of bed, going to a gym with a trainer, getting my anxiety-induced niece who was failing school, thriving, straight A student, getting my best friend at the time off of cholesterol pills. Right?
I mean, it's amazing. Like I was going down the path through medical school, and I call it practicing medicine. And when I got into the education part, and literally they're like, that's what they teach you. If you don't get it right the first time, try the second time. Don't show it out loud in the room, really. Yeah. My mother was killed by medical malpractice, and I used to have a colostomy bag, and I went down a rabbit hole. If you hear my talk, I know we just met, so I'm excited to know you more, and I speak at these conferences, but I reversed my colostomy bag, and I tell my patients, because they say the blood doesn't lie, but okay, well, how does that relate to your DNA as well?
Yeah.
Because you could take blood tests all day and be deficient, like even my mom was deficient in iron. So they keep giving her iron, and then she wasn't absorbing it. It was storing on her brain stem, and it actually showed up it was like pseudo dementia. She was acting crazy, and we had to detox her because she wasn't even absorbing her supplements. They were just storing. So
the blood doesn't lie. But if you don't know how to interpret it, this is what's missing from all testing. And this is why I don't even call the DNA company a testing company, it's an interpretation company.
I love that.
What does it all mean? Right?
Yeah.
So, because if you don't know what it means, it's just data's dumb. You need insights. And so, just to your point, there's somebody I was dealing with a week ago, through blood work, was told her selenium is low. Blood doesn't lie, right? It's low. So, the answer, is it to give her more selenium?
Yeah.
Or to dive into biology and interpret? Selenium is a chelator of mercury. So if your mercury levels are high, your body's overutilizing selenium for that purpose. So the real insight is you have heavy metal poisoning, not your selenium is low, here's a supplement, right? Yeah. And then the supplement doesn't work. Why doesn't it work? Because your body is drawing all the selenium stores to deal with this. So knowing somebody that has the insights, like the brilliant work you've done and fixed your body, this is where all functional testing is going. Yeah. Right? And where the lab work it doesn't work anymore.
Yeah, I started working with MeScreen, if you know that company, and it's like a mitochondrial function test, but it's really important having that interpretation.
Yeah.
Because even working with Brain Tap, and Dr. Porter says knowledge is power, but only if you're applying it. Because people receive so much data, but what are they going to do with it? Are they going to get advice, nutrition advice, guidance? What are they are they going with that pathway? So that's amazing how you're bridging the gap between and direct access, right?
That's the other thing, direct access. So now, up until say pre-COVID, most people believed if my insurance company doesn't cover it, I'm not touching it. Yeah. Right? So there's a bit of an entitlement to healthcare. Yeah. And that's intentionally part of the design. It's not designed for,
I got to get into that because I'm a private pay clinic. We don't take insurance, and it's a big...
And I'm sure your outcomes are much better than the people that
100%,
right? Yeah. Because you now have a toolkit that is much broader, bigger, and actually useful versus here's the stuff that we cover. We don't actually solve the problem. So it's by design, because the insurance company is not designed to insure, it's designed to facilitate and administer a plan, meaning they're profiting from every step of your sickness. Right?
When I worked in the ICU, skilled nursing facility, it's like walk the patient this far, because if they walk this far, then they get discharged. Or if they have this oxygen level, then they get a machine. And it's like you're manipulating data, because when I started doing my passion and driven by universe and God and what I believe in, is I'm going to walk them to their ultimate capacity. And I actually started documenting from ICUs, nursing facilities, unlimited distances. And I walked this as when I opened my own clinic, and for Parkinson's and people post-stroke recovery, because I started taking my patients rounds and rounds, but we would sit, we would take breaks, we would apply everything we ever known. We didn't just walk them to the bathroom and back and say, bye, you're tired. You know, that's it. And that's all I wanted to do. And you'd be surprised, I actually got in trouble for that. We're not paying you for that. And then I was known as the doctor that stayed later, which was killing my heart and soul, because I couldn't just leave them. And I told you what happened to my mother. So I treat everybody like my mother. I treat everybody like my father, my children. It's my do no harm first. My ultimate value in my clinic. I do an internship. So that's important for me, to teach the students to do no harm and to find those, to make it not practicing. Do the research, do the work to heal the patient the best they can. So without the insurance model, people call all the time, do you take insurance? And I say, no, we don't. But, and by that time, the phone could hang up, right? So now what we've started to say, yes, we do. But we don't take the insurance that you're used to. We're so we actually started saying yes in the beginning, just to keep them on the phone and say, well, yes, we are working towards that. Because we are working towards bridging the gap between functional medicine, mainstream medicine, for me, ancient wisdom, and I am also into plant medicine myself. So that's my journey. But, you're definitely a huge part of that. And I think that's amazing.
We're this whole functional medicine world, that's another thing that's being different. It's all coming together, right? All these fragmented pieces are coming together, and everyone's working together, and all the pieces fit together, versus very intentionally separating things, which is how allopathic medicine works, right? So you talk to the heart doctor, has no clue what a foot does, right? If you can't treat the body, the heart doesn't decide to break. Right, the liver is doing something to not detoxify, and then the inflammation ensues here first. So this is why allopathic medicine doesn't know. So and this is why the approach is the opposite, where everyone's coming together because we all support each other in our specialties.
That's why I love conferences like this. And when you grow up and have a condition, like for me was Crohn's disease, rheumatoid arthritis. When I was pregnant, or if I met a dermatologist or anything, they're like, well, go ask the gastro, you have Crohn's. So it's like, whatever is your most biggest disease, I call it the canary in the minefield, because they send the canaries out into the mine. And I think a couple of people who've probably been through a similar situation came up with the same analogy, because we're all each other. But if the bird, the canary comes back, the mine is safe. So the canary's like people with chronic illness. And we keep going out there. And my mother didn't come back. She was a canary, that didn't come back. And I was one that did come back and got stronger. So I'm excited to learn more about your company and see how I can bring it into my clinic with my patients. Do you guys have an affiliate program, or tell me more about that?
So where we started was direct-to-consumer testing to empower people to know and to take charge. Because if I know my DNA, and I know my DNA is never going to change, the DNA I'm born with is the DNA I die with. It's a permanent tool. And that became, how do we empower their clinicians so that they can actually incorporate the tool? And I'll probably change their protocols and programs, because now they're going to think about the body differently. And we built a continuing education credit training. And we built programs for clinicians to integrate not only DNA testing, but epigenetic testing, gut testing, early detection cancer screening, breast cancer early detection screening. So there's a whole bunch of stuff that's coming on board, all going through the same modality of let's empower the clinicians.
And how do you collect the DNA?
It's saliva. So it used to be a saliva tube, 5 milliliters, but the technology got better, so now we could just use a swab. Anyone using a swab 5 years ago, it didn't work, right? It's now working. And so it's just a simple saliva swab.
Gotcha. So I was going to say, they have these frequency devices that say they can scan everything, but you would say the saliva is more accurate?
So if the device works, that works also, right? But in terms of knowing your DNA. So frequency will more likely give you how you're expressing in the moment, right?
Okay.
It's measuring the actual frequency,
Okay.
right? Meaning if you ate a piece of broccoli today and you're,
That's right, yeah.
you slow down some hormone pathway.
Exactly.
So its frequency is measuring where you're at right now.
Yeah.
And it works. I agree, it works. And so DNA is who are you before that expression change. That's
my son was eating Chipotle and I was testing out a device at my clinic. It scanned him and then it said he had this stomach condition.
Yeah.
And I called the company. I was so upset. I was like, how could this be? This is so upsetting.
Yeah.
And then one of the science officers said, well, did he fast? And well, it was in protocol.
Yeah.
Because there's a lot of equipment out there, wasn't in the protocol. And I was like, oh my God, what's in that food? What is in Chipotle? Though it was Chipotle he was eating. And I'm like, maybe not such good food from what came up, which I'm not even going to say. I don't want to put that in the universe. Yeah. But so I thought, okay, frequency is good, but what is not being affected by, your environment? And well, your DNA is not affected by your environment. Your frequency is. So that's pretty awesome and accurate.
Yeah.
Is there, you said there's any next steps for your company or?
Yeah, so I stopped running the company a year ago.
Nice.
And we merged with a telemedicine company to take all of the insights and plug it into the healthcare system.
Okay.
Right? So the mission is, okay, we're helping a lot of people. How do we help way, way more? Mm-hmm. And it is all those people that rely on their primary care doctor, are wanting to go to hospitals or wanting to rely on their insurance. How do we give them access? Mm-hmm. Even though they don't even know they need access, right? That's the next step, is taking all these wonderful insights and applying it to the greater healthcare system. And there's a whole new team doing that right now.
That's awesome and beautiful. Like what you said, when you go, especially when you're sick and you have to go to a primary care and get a referral and go here and go here and go here. By the time you get all the way around that, you're tired and often people give up. Yeah. So when you get out of the insurance model, you can do a lot more with your healthcare. At my center, they call it the Cheesecake Factory of Healing because we have so many things. And then within 1 hour, it's time really dependent. Yeah. We have memberships where people will come in for an hour to however long. And no matter what we have in the clinic, we use. It's literally each device I have, people will give you a return on investment. Yeah. This is how you should add it into your clinic. And my clinic is really time-based, and we stack the biohacks. Cool. So we do as much as we can, and if I can't do it, while they're doing their treatment, I'm calling everybody within this network who can help this person because, again, doing no harm first is very important. And if you take on a DNA test, you can become a lot safer with your care because you could be taking a supplement, and if you don't even have a precursor to be able to metabolize it, you could have a buildup like, I've seen in my loved ones, and it could cause other conditions. So thank you for this interview. I think it was beautiful. And if you guys want a DNA test, I will sign up an affiliate link so you can go to my page, or you can go to the DNA company.
Yeah.
All right. Well, sounds good. Thank you.
Yeah, good seeing you. Pleasure.
All right. Bye. Thank you.
Unlock your full potential at the Biohackers World Conference and Expo in Los Angeles on March 29th and 30th. Connect with leaders in health optimization, learn the secrets to longevity, boost your performance, and dive into the latest biohacking and wellness innovations. Don't miss out. Tickets are going fast.